How do common drugs make gout ULT side effects worse? Imagine starting a treatment to lower your uric acid, only to find your symptoms temporarily getting worse. That's often because of how these drugs work in the body. Uric acid lowering therapies, or ULT, like allopurinol, febuxostat, and pegloticase, aim to reduce uric acid levels in the blood. But when they begin, they can sometimes cause more pain and inflammation before things get better. This happens mainly because these drugs cause rapid changes in uric acid levels, which can disturb the crystals already deposited in your joints and tissues. When the uric acid drops quickly, the crystals start dissolving and releasing into the joint space. This process irritates the joint lining and triggers inflammation, leading to what's called a mobilization flare. These flares are common when starting ULT and can make your symptoms feel worse temporarily. To prevent or lessen these flares, doctors usually recommend starting with low doses and gradually increasing them over several weeks or months. They also often prescribe anti-inflammatory medications like colchicine or non-steroidal anti-inflammatory drugs for 3 to 6 months during this period. Certain medications used in gout or for other health issues can make these side effects worse. For example, allopurinol can cause skin rashes, nausea, and in rare cases, severe reactions like Stevens-Johnson syndrome. When you begin treatment, the rapid change in uric acid can also trigger gout flares, making joint pain worse temporarily. Febuxostat, similar to allopurinol, can cause similar side effects and requires the same preventive measures. Pegloticase, used for difficult cases of gout, can cause serious allergic reactions during infusions and also leads to mobilization flares because it reduces uric acid levels very quickly. Other common drugs can interfere with uric acid levels too. Diuretics like loop diuretics, often used for high blood pressure or swelling, reduce the kidney's ability to clear uric acid. This can increase uric acid levels and make managing gout more complicated. Low-dose aspirin and cyclosporin, medications often used in other health conditions, can also impair uric acid excretion. These interactions can cause uric acid levels to fluctuate, increasing the risk of flare-ups or kidney issues. Because of this, doctors may need to adjust doses or closely monitor your kidney function and uric acid levels during treatment. Managing side effects involves more than just adjusting medications. Drugs like colchicine, used to prevent flares, can cause diarrhea, nausea, muscle pain, and nerve problems. These side effects can add to your discomfort during gout treatment. Non-steroidal anti-inflammatory drugs and corticosteroids, used to treat flare symptoms, also have their own side effects, including stomach irritation and kidney stress. That's why careful management is essential. Starting ULT at low doses and slowly increasing them helps reduce the risk of severe flares. Using anti-inflammatory medications beforehand and monitoring kidney function and uric acid levels regularly are key strategies. Patients should also be educated about the possibility of initial worsening and the importance of sticking with their treatment plan. In summary, common gout medications can make side effects worse at first because they cause rapid changes in uric acid levels, which mobilize crystals and trigger inflammation. Drug interactions and the side effects of additional medications can also contribute to this. The best approach is careful dosing, preventive anti-inflammatory therapy, and close monitoring. Always consult your healthcare provider for personalized advice, as individual responses can vary. Remember, managing gout effectively requires patience and proper medical guidance to minimize discomfort and long-term complications.